When the Ebola came in, the naysayers, oh, Ebola, Ebola, and somebody woke somebody, say, drink salt, bathe with salt water. Do you know how many that died? Somebody's opinion that it could work, and a lot of persons died from that. Vaccines are tested over time. The reason why the malaria vaccine did not come up before now is works in progress. It's over 50 years this discussion started. But you see, with vaccination, it has been the game changer around healthcare. And again, the deficit posture of white man and black man, I don't take that argument. You have a lot of blacks that have left Nigeria and gone abroad and still doing wonders. These studies are not 1, 2, 3 professors. Before these vaccines are introduced in other countries, they have gone through clinical trials. They are still undergoing. We're introducing the RO21 vaccine, RO21 vaccine. There are other variants of this vaccine. And again, just to put it in perspective, these vaccines, when we qualify, we take them. We introduced monkeypox vaccine. I took a shot. The Commissioner for Health took a shot. The partners, a few of them there, took this shot. So it's not that we're bringing something we don't even try. I took 3 shots of COVID. It was to prevent the severe forms of the disease. You know, who is alive is lucky around these things. Then you need to prevent yourself to be luckier. So that's argument to say the whites are dumping donors and partners. That is not a very correct assertion to make. The world is a global village. People travel every day. You know, when you think COVID was in China and China was a few 14, 15 hours away, it didn't take quite long before, you know, COVID got to Africa and Nigeria. So we need to see how we can encourage ourselves. We're doing everything to prevent these diseases. As a side effect for malaria treatment, once upon a time it was chloroquine. And I never liked my dad because of that. How would you treat me with chloroquine?
Don't remind
The
me.
whole night you will scratch. They said drink coconut water. There's nothing we did not drink. So the pain is still there. How can we prevent children from not even experiencing that pain of chloroquine, you know, in treatment? So we are working towards getting the vaccines to everybody. We'll see how we'll get to everywhere. Even though the schools are not on, the idea is injectable vaccines once the parents have the conversation with them before we give them these vaccines. Most of the ones we do in schools are oral vaccines and all of those. And of course, when we introduce HPV, we will catch them in school. Because of course, vaccines are not forced on people. You seek consent before you give, especially the adults. I think this has to be put in perspective again, what we do in primary healthcare. We speak to ownership of primary healthcare by communities. Every health facility in every community is your own. Protect it. Make it a sanctuary site, you will need it. The healthcare worker in these facilities are yours. Government has engaged the few we have. Government is paying them salaries. It is your responsibility to keep them in your community to save you and help you with all of these. The complaint shouldn't come that, oh, the man is not coming to work. You talk to him, encourage him, and keep him there. He's the policeman for healthcare in your community. So address it like that so that we can be safe and better. We're at primary healthcare. We're not at treatment mainly. We're at discussion of prevention. And so we must enlighten. Prevention is a whole spectrum. And so we're taking this advocacy step to say, everybody, sit up. Malaria is here. If I put on a light note, growing up as a child, they told us Mungo Park was killed by malaria. To tell you how old this story is, always stuck in my head till I became a doctor. Ordinary malaria, key white man, and Mungo Park. But yeah, he died of malaria because this is a burden that has been here over time. And again, whereas we are healthcare workers and we're here, I want to thank Mr. Erizia for bringing us here to say, let's just have this conversation because it is a co-creation for us to support this malaria prevention. We have to do it together. This advocacy has to get to everybody. Governance is both ways, the governed and those that have been governing the government. You know. So we need to put things in perspective and say, let us help and fight malaria. In one of those anti-malarials, that have been, quite a number of them are in the market. In one of those ones, there was one song, say malaria or don't pafuka or malaria or. It was quite interesting how they were advertising. Now we must make malaria own pafuka, really. We must spoil it for mosquito so that we can live peacefully. And this is where the campaign is. Now, to put a few things again in perspective, the cost element of treating malaria, let's put it this way. A woman that has 4 children and treats malaria every 3 months, that she's going to treat them 4 times in a year, and she spends an average of, let's say, 10,000 in quarterly. So she does 40,000 in a year, she's probably doing 160,000. Now, this is to be modest. Let's assume they didn't get to the hospital, they went off the shelf and bought anti-malaria medications. Again, resistance have come. So there are newer ones that are coming with side effects and adverse effects thereof. So this burden, this cost element has sent a whole lot of persons into some level of poverty. Now, let's take it to the extreme now. A woman that has one of these 4 children admitted in the hospital for severe malaria, they need to transfuse because there's severe anemia. The cost element, by the time she's done, we have spent 200,000. And by the time she's coming back, mosquito had beaten her in the hospital. She's now started treating herself. The next thing, the other children are home. She probably was not there to hang the mosquito net since she was in the hospital. It becomes a vicious cycle. So let us break it with vaccination. The burden is there, the problem is there. We need to now tackle it head on, collaboratively. The government is playing its role fantastically, especially with the robust healthcare agenda in the assured agenda for prosperous Bayelsa. So the steps are being taken. We need to fix it. We need to fight it. And this is not just malaria alone, like I said, other vaccines. But then we're in pole position to have this conversation. Because you see, we're here in this. We must fight it. We must fix it.
So as it is now, we have almost overshot our target for the month and all. So there's a huge acceptability for the vaccine. People are coming out and they are really, really accepting the vaccine. And let me also mention something. When you talked about the insecticide treated net, sorry sir, to respond to you. I know ES said something about substandard products, but you see, it's not every mosquito net that is available that is insecticide treated. So there are some that are just mosquito nets. Yeah, they are just mosquito nets. So those the mosquito will dance on it because there's nothing on it to affect the malaria. So we need to also know that. So when you're buying a mosquito net, be sure that is before you say the insecticide treated nets are not working, check whether you actually bought an insecticide treated net. You may have just bought another mosquito net and thought it was an insecticide treated net.
Yeah. Somebody said on the light one again that his problem is not that mosquito is biting him, but that singing part on the ear. Like, why do you have to, why does the mosquito need to sing? It wouldn't stop an animal from existing because it's a vector. Animal rights and all those environmental issues are there. But then, this is causing a problem. That is why, in trying to fix the malaria burden, the other preventive measures, the killing of mosquito through slapping, killing of mosquito through insecticide, there are levicidal products that have also come. But then the cost element, like you said, to spray it in the Niger Delta, it will require an helicopter, it will require, and again, if that is done, it will not clear everything in one swoop. So it is a burden, and we have to collectively do it. So if everybody does all the things we're saying, prevent stagnant water from our environments, let's clean our gutters, clean the environment, and we don't have anywhere for mosquito to breed, how will mosquito now carry malaria and give to us?